Hello everyone. So now we will talk about the diagnosis and management of glomus tumor of ear. So diagnosis is best made by contrast enhanced CT. Here in contrast enhanced CT, we see the absence or the erosion of crest of bone that lies between the jugular bulb and the internal carotid artery. And this sign is what is known as flap sign. As you are seeing in this image that is labeled, we are seeing the black area, that is the middle layer cavity. Below, separated by a sigmoid plate, is our jugular bulb, and above, separated by a crest of bone, that is the jugular crest, is our carotid canal. And in the case of glomus tumor of ear, this jugular crest that lies between the carotid canal and jugular bulb is eroded, as you are seeing here. Okay, and this is what is known as flap sign. Another investigation is MRI, that is done to see the intracranial extension of glomus tumor. And here we see a classical appearance, that is salt and pepper appearance. Though this is not the image of the glomus tumor, but here we are easily seeing the salt and pepper appearance. Here the areas that are appearing whitish, that are salt like, are because of hemorrhage, and the void areas appear black and known as pepper, so the appearance salt and pepper. And now we will try to talk about the management of the glomus tumor. While managing the glomus tumor, we follow the fish classification that classified the management based on the extent of the disease. Now, type A is when the disease or the glomus tumor is limited to middle layer. In these cases, we will remove the disease through middle layer by a transmeatal approach. Whereas in the cases where middle layer plus mastoid is involved, although we will do a transmeatal approach to remove the disease from middle layer, plus we will do go for facial recess approach from the after doing mastoidectomy to remove the disease from the mastoid. Type C is when the disease has reached the inner ear. In these cases, when the disease has reached inner ear or infralabyrinthine, we go for an infratemporal foci approach. Now, type C is divided into three categories. Consider this as our carotid canal. So this is the vertical part. So if there is a limited involvement of vertical part, that is the C1, and if there is a extensive involvement of vertical part of carotid canal, that is C2, and if horizontal part is also involved, that is what is known as C3. After type ABC, we have the type D, where we have intracranial extension and which has reached the posterior cranial fossa and the middle cranial fossa. Here we have D1, type D1, that when the tumor is less than 2 centimeter, or type D2, where the extent of disease in the cranial fossa is more than 2 centimeter. And in these cases, we manage by posterior cranial fossa craniotomy. Okay, now if the tumor is very small and there are no sign and symptom, since this tumor is very slow growing, we wait and watch further for a long time. Another thing is, if the tumor size is less than 3 centimeter, we go for a radiosurgery, that is gamma knife therapy. This retards the growth of tumor. Okay, and always after doing the surgery, we check for the level of urinary vinyl mandelic acid and urinary catecholamines. So this is what we needed to know about the glomus tumors. Thanks for watching.